Welcome back to our channel. Today we will talk about a topic that affects millions worldwide, norovirus, from its causes, symptoms, and prevention strategies. Norovirus, also known as winter stomach bug, is a highly contagious virus notorious for causing outbreaks for gastrointestinal illness. But what exactly is norovirus and how does it spread? Norovirus is a group of viruses that causes acute severe vomiting and diarrhea. It is the most common cause of gastroenteritis in the United States. Norovirus outbreak usually happens seasonally in colder months and is the #1 cause of foodborne illness in the United States. Globally, about 685 million cases are reported each year. Of that estimate, over 200 million cases affect children. In United States, norovirus causes on average 900 deaths, 100,000 hospitalization, 460,000 emergency room visits, 2.1 million outpatient clinic visits, and 19 to 21 million illness. Symptoms of norovirus usually appear 12 to 48 hours after exposure to the virus and last 1 to 3 days. Symptoms include sudden onset of nausea and vomiting, diarrhea, and abdominal cramps. Some may experience low-grade fever, headache, body ache, and fatigue. These symptoms typically last for a few days, but the virus can linger in the environment for weeks, posing a risk of further transmission. Norovirus spreads primarily through close contact with someone who has the virus, touching contaminated surfaces, eating and drinking contaminated foods and beverages. When it comes to food contamination, the virus typically spreads when someone who has the virus touches food before serving it to someone else. Sometimes, certain foods, including oysters and other seafood, are naturally contaminated with norovirus. Can norovirus be prevented? While norovirus can be challenging to avoid completely, there are steps you can take to minimize your risk. First and foremost, practice good hand hygiene. Wash your hands frequently with soap and water, especially after using the restroom or before handling food. Norovirus is resistant to alcohol sanitizer and requires bleach for sanitization. When it comes to food safety, ensure that you cook seafood thoroughly, wash fruits and vegetables before consumption, and refrain from preparing foods for others if you're experiencing symptoms of norovirus. Avoid contact with people who have norovirus infection. You can also prevent norovirus by cleaning and sanitizing frequently touched surfaces and objects. You can make homemade sanitizer by diluting household bleach in a ratio of 1 to 100. For example, you can mix 10 milliliters of bleach in a liter of water. Also, wash your clothes thoroughly, especially if they are soiled. How is norovirus treated? When it comes to treatment, there isn't a cure for norovirus. Treatment for the infection focuses on relieving your symptoms, which will go away in 1 to 3 days. You can manage your symptoms by drinking plenty of liquids, especially liquids that contain electrolytes, getting a lot of rest, and eating soft, bland foods. And remember, norovirus cannot be treated with antibiotics. Are there any complications from norovirus? If you have norovirus, you'll feel very sick. This can cause you to throw up and have diarrhea. When you are unable to keep nutrients in your body, you are at increased risk of dehydration. Symptoms of dehydration include peeing less often or having dark-colored urine, having a dry mouth, feeling weak or dizzy, and having a headache. Children may have the above symptoms of dehydration, along with crying without tears, fussiness, and sleeping throughout the day. To avoid these complications, eat and drink more often throughout the day, eat slowly and take small bites, or take little sips of fluids. If you eat too quickly or too much, your body may reject the food you eat. Here are some facts about norovirus. Some norovirus infection can occur without symptoms. Infected people can shed large numbers of norovirus in feces and vomit. After your symptoms stop, you are still contagious for up to 48 hours. Virus can persist on the surface for up to 6 weeks. Commonly available alcohol-based hand sanitizer are not effective against norovirus. And currently, there is no vaccine available for norovirus. Remember, staying informed and adopting preventive measures are crucial in fighting norovirus. By taking these steps, you can protect yourself and others from falling victim to this highly contagious virus. If you found this information helpful, be sure to give this video a thumbs up and subscribe to our channel. Until next time, stay healthy and remember, health is the greatest wealth.